Hello, hello, hello. Good day, good day. This is the new dentist coach, not Dr. Hayes, Darwin Hayes. Dr. Darwin Hayes here, the new dentist coach, coming live today with a tip, another tip today for my new dentist out there. I can be reached and followed on Twitter at Smile Dr. Darwin, also at New Dentist Coach on Twitter. Again, coming today with a residency tip, actually a tip for new dentists about specialty programs. Right now, we've been seeing a trend, a heavy trend in a lot of residents and even students that are applying to residency programs. The top ones right now are pedo, endo, ortho, and oral surgery. Those are probably the top four. Uh, at my residency program, where I'm the program director, we've noticed uh, all three of those. People have been applying to all three of those, but endo has been one of kind of like the top one or two of those top four. And we recently have had some people apply not only once but twice over the period of 2 or 3 years. And one of the things we always like to do, whether they're a first year resident or even a second year resident, is to reach out and try to help them enhance their chances of getting into a residency program. So I thought it would be a good idea to actually talk about some of a couple of tips that recently have shown to be very beneficial. We have one resident who who is pursuing the endo specialty, and he's applied I think twice so far. Unfortunately, he hasn't been successful, but after talking to him not so long ago, found out maybe a couple of reasons why he hasn't been so successful, and those are going to be the reasons and the actual tips that I'm going to talk to you about today. So again, today's tip is specifically about those people that are applying to endodontic residency, specialty residency program. And I've got a couple of tips I want to go over. Actually, there's 5 tips today that I want to go over, so you guys have an idea. Tip number one. Tip number one. Number one. You gotta have a portfolio of your cases. A portfolio of cases. Okay. I can't stress how important this whole notion is. Not only do we promote that here in the residency program, and when I speak to dental students, not only for specialty programs but also for GP. If you're people that are going into private practice after residency, the importance of having a portfolio of your cases is really, really key. Not only is it a good communication tool for you communicating to the patient about treatment, about what's the problem, what's going on, but also it's great for providers, employers, program directors, people that are interviewing you for residency positions to kind of get an idea as to what type of person you are and what kind of clinician you are. But especially for endo. So one of the tips that we that I often share with those residents that are interested in applying to endo is you've got to document all of your cases, not one, not two, all the endo cases that you're taking on. And primarily it's a before and then an after picture, but also you want to write a narrative as to the actual case and what were some of the challenges, what you use, what methods, etc. Okay. With today's technology and the ability to take and use your smartphone, you can take pictures of the x-rays before and afters, even a working length film, however you want to put it together. I would say no more than for each case, no more than 3 photos before, working length photos, master cone photos, and then a final picture. And then you write a little 3 to 4 or 5 paragraph. I'm sorry, 3 or 4 sentence paragraph about the actual case. All right. In addition to the portfolio of cases and having all your cases numbered, you want to put them both together, maybe in a binder. I was trying to grab one here in my office, and I have one that I can grab. But you can put them in a binder, okay? Or you can upload them to your website. Everyone should have their own individual website. You don't have to be in business to have a website. You don't have to be in an office to be able to have a website. You, as an individual, as a new dentist, you are your own business. You are the business. So you should have a website with your name. You could use it as a portfolio, as a CV. Use it as a CV, and you have all your documents, all your background information, but also you have your portfolio of all of your cases. So that's tip number one. Have a portfolio of all your cases. And the reason why you want to use that portfolio is that when you go into interviews, you'll have a piece of paper or you have a binder that you can actually show the program directors, other residents, and all those faculty members that you're going to be interviewing. So portfolio of cases is tip number one. Tip number two, you want to go to the national meeting of the AAE, which is the American Academy of Endodontists. Every year they have a meeting. I think it's in April. This past year in 2016, it was in San Francisco. I encourage everyone who's applying to go to that meeting. That going to that meeting not only gets you more reality as to the profession or the actual specialty program, specialty environment that you're going to be going into, but that's a great place to network. Even if you do have some classmates or people that you know that are endodontists or endo residency programs, you want to take it the next step. Take it a step further. And that next step further is going to the meeting and meeting people, networking, okay? No one cares about who you are on paper. What's more important is that you network face-to-face, eye-to-eye, voice-to-voice, handshake, and so they eventually, the goal is they eventually can put a face to the name that's on the application that's going to be sent over. The application process today has changed drastically. You have a lot of schools, dental schools, and programs where they are not doing GPAs anymore, and most of their classes are pass-fail. In addition to that, board scores are also not being utilized to the point where they were 5, 6, 7, even 10 years ago. For specialty programs like endo, program directors relied heavily on GPA, board scores, etc. So with those things kind of being thrown out the window, so to speak, you've got to figure out, all the applicants and candidates have to think of something that's going to make their application pop. And I would say if you have a stack of applications this high, somehow you got to make your application come from here and then get on top. And one of the ways to do that is doing something that's extraordinary and helping you, what I call, get out of obscurity. My residents will hear me talk about that all the time, getting out of obscurity. If you don't know what obscurity means, look it up, Google it, define it, learn it. Getting out of obscurity. No one knows who you are, even as a candidate and you're applying. Just because your name is on the application doesn't mean they know who you are. You're still obscure. You're unknown to them. So tip number two, going to the AAE meeting is key. It's key. You want to go and meet people. Give you an example. One of the residents did this for the first time. It's been 2 years. I've been telling him, you got to go to the meeting. You got to go to the AAE meeting. Find out where it is and attend. He went, and guess what? Not only did he meet one program director, but he met 2 or 3 other program directors. He got a chance to meet a couple of residents, current endo residents at a program that he definitely wants to go to. He actually applied to the program last year and was unsuccessful, but will be able to. He's planning on applying again this year. But just that one thing, just emphasizing and implementing that one tip number 2, by going to the meeting, he was able to go meet the program director for this program that's number one on his list. Spoke to him, spoke to some other faculty, spoke to the residents, one of which was a previous resident at our residency program, and he made some connections. He was able to network some, and he came back and told me that advice, that tip, and him doing that, he felt so much more confident about this upcoming cycle and his application. So tip number 2, go to the AAE meeting and make sure that you network. You have your business cards. You should have a copy of your portfolio in case it comes up. But you want to be able to meet people, ask them for their business cards so that you can follow up, and we'll talk about that in a minute. Number three tip is, I just talked about it, meet the program director. All right. Hopefully, if you're going to the AAE meeting, you'll be able to, they have all the schools that have endo programs will have a reception at some point. Even if you don't know anybody there, just walk in, make yourself comfortable, and, act like you are supposed to be there. All right. And go and meet the people. Again, your goal is to meet the program director and make your application stand out by them connecting and you connecting with them eye to eye, face to face. Okay? So we want to meet the program director, also meet some of the residents also. Tip number four for new dentists that are applying to endo residency programs, some tips. Tip number 4 is visit the program before applying. You got to visit the program. Again, endo is probably one of the top 2 of the top 4. Endo is probably top 2 residency program that's everyone is applying to. And one of the things that I've been hearing is that there are people going to the programs prior to them applying. You got to do that. If everyone else is doing that and a couple other things, and you're not doing it at all, guess what? Your name's going to be left out of the equation when it comes time to granting interviews. And that's the goal. That's the first step. You want to be able to get the interview. We'll have some more tips about what do you do in the interview, but the first thing is you've got to get out of obscurity, and you got to go. One of the ways to do that is going to visit the program before applying. Lots of times I've had some residents ask me, Dr. Hayes, what's the best way to do it? Should I call them, make an appointment? Should I stop by if I'm going to be in the area? And I tell them yes, and yes. Do all the above. Don't be reasonable about it, because at the end of the day, they have something that you want, which is they have a position for endo specialty that you want. So you have to, think of a mindset of not being reasonable about it and actually going and attacking and getting that position or getting your face in front of those people that are in that program. So tip number 4, visit the program before applying. Again, meet the residents. You want to meet the residency coordinator, all right, the person who's doing a lot of the administrative things, the person that's opening up the applications, who's scheduling the interviews, anything, the person who's helping any of the residents throughout the 2-year or 1-year period of the residency program. You want to meet that person, get their business card, and connect with them. And usually the best time I tell people to go and visit the program, if you're in dental school and you're applying out of school, you want to go over a break in between clinics, all right? And just make yourself available to go and especially I'm talking about primarily your top programs. Even if it's a program that's local, but even if it's far away, and maybe you may have to get on a plane ride or get on a bus or get on a train to get there to visit the program, but you've got to visit the program. It's not optional anymore. Okay, so that's tip number 4, and then the last tip we have for you today, endo specialty program application tip is follow up. Follow up after getting your portfolio of cases done, after going to the AAE meeting. After meeting the program director, after visiting the program, and actually meeting the residents, meeting the residency coordinators, the fifth step, and probably the most important step, is following up. Okay? Don't wait for them to contact you. You contact them and follow up. It's different ways to follow up. I always recommend I call a trifecta a way. You can first give a phone call, ask to speak, or leave a message to everyone that you spoke to, everyone that you met at the meeting, or everyone that you met during your visit, your on-site visit. You want to call them and leave them a message. Hey, Dr. Smith, this is Dr. Hayes. Just want to say thank you for spending the time on my visit. It was great meeting you. Looking forward to getting interviewed and being a part of your program. All right. The second part of the trifecta is send an email. You're going to type up an email pretty much saying the same thing. All right. Pretty much saying the same exact thing. And then the last part of the trifecta of the follow-up, what I recommend is the old-fashioned way. Where's my pen here? The old-fashioned way. Pen and paper. All right? Pen and paper. Buy yourself some nice stationery. Doesn't necessarily have to be really, really expensive, but some nice stationery. And then what you're going to do is do it the old school way. You're going to write a thank you note to that person that you met, expressing your gratitude for them to take the time. Also, you want to express your interest again, reiterate your interest in the program, why you thought it was important. And then you may even want, I always tell people, find something that you like about the program or about the person that you actually met during your visit, and you want to include that into your letter. Again, make it personalized. And again, you're trying to stand out above and beyond all the other candidates that maybe probably have not visited, but even if they have and they've done all the 4 steps, the coup de grace, or the icing on the cake, is the 5th tip, which is the follow-up. But a buddy of mine always says, the fortune is in the follow-up. The fortune is in the follow-up, meaning you get to cross the T's and dot your I's and get what you want when you follow up. All right. So those are the 5 tips for those new dentists that are applying to endo residency programs. Part of it, some of it can actually be applied to a couple other programs. I have some other tips with regards to some of the more specific tips for other programs, but those are the 5 tips for endo. Again, number 1, portfolio of cases. Number 2, you want to go to the AAE meeting, American Academy of Endodontists meeting. Number 3, meet the program director. Meet the program director. Number 4, you want to visit the program at some point before applying. Okay, visit the program. And then number 5 is fortune. Fortune in the follow-up. You have to follow up on your actions. Send an email, telephone call, write a letter, and also send a thank you note. So hopefully that's been helpful for you guys. If you guys ever have any questions or have any a couple topics that you want me to talk about, you can always reach me. Check down below, right down here, at newdentistcoach@gmail.com. newdentistcoach@gmail.com. Also, you can follow me on Twitter at Smile Dr. Hayes. That should be up there somewhere. Smile Dr. Hayes at Twitter, and also at New Dentist Coach. New Dentist Coach on Twitter. All right. Check out my weekly blog. We're on WordPress. DrDarwinspeaks.wordpress.com. DrDarwinspeaks.wordpress.com. And you can Google us on YouTube. A lot of the tips, the video tips that I give out we have a whole library of different tips that we're developing and sharing with you all. Again, my purpose here is to help as many new dentists as I can through this process as they transition into the next phases of our profession. So good luck to you. Keep in contact. Keep watching. Follow me, and I'll talk to you soon.